Thank you so much, Susan. Just give me 1 second to share my screen. Okay, so as Susan mentioned, I lead the Food and Prison Project at Impact Justice, and I'm here to talk about how food in carceral settings in the US is really a national crisis on a grand scale. The US incarcerates more people per capita than any other country. There are about 2 million people currently locked up in the US. There are also about 5 million people on the outside who have done time in federal and state prisons, and over 10 million people cycle through local jails each year. And even if this issue doesn't directly impact you, then you probably know someone in the US for whom it does, because 1 in 3 adults in this country has an immediate family member who has spent time in prison or jail. So just to give a bit of extra background, in a report that we published in 2020, we talk about prisons as sites of food apartheid and explain why the crisis of food on the inside can't be viewed in a vacuum, but rather mirrors and is inseparable from prison food justice issues on the outside. We know that the people who are at the highest risk of food insecurity, nutrition insecurity, and trauma on the outside, so generally folks from a lot of low-income communities, Black and Brown communities, those are the folks who are disproportionately thrust into a carceral system that continues to replicate those patterns. And really, the best way to sum up the 137 pages of our report is through a quote from one of our interviewees who said, "The food there in the prison system was really designed to break your body and your mind." So for those of you who are not familiar with prison food in the US, here are some real life examples. These are actual meals that were served on the inside. Prison meals tend to be very, very high in ultra processed foods. There's a lot of white bread, a lot of like hot dogs and lunch meat, ultra processed soy food, a lot of powdered fortified beverages that are meant to be the primary source of vitamins and minerals for people while they're incarcerated. The diets are also very high in sodium and sugar, very high in refined carbohydrates, very low in nutrient-dense foods like fruits and vegetables, quality proteins. We all on this call probably already know that this is a diet that leads to poor physical health and early death, as well as mental health issues from depression, impaired decision-making to aggressive behavior. And people who are incarcerated generally don't have a choice to eat less processed food. The choice is either eat it or don't. And plenty of people have spoken to us about starving while they're incarcerated, either because the portions are too small to really make them feel full, or because the food is simply too bad to eat. And so many people rely on from the commissaries or canteens, which are basically like convenience stores. They sell a lot of ramen, chips, soda, things like that. So those who can afford it tend to supplement with even more processed food, highly processed food. I also want to talk a little bit about, I hope no one is bothered by my use of the term, but the ultra processing of people. So not just the food, but the sense of warehousing people, of depersonalizing people, which you can see in this image of a chow hall here. It's overcrowded chow hall. People are taken out of the natural context of interacting with food and are forced to eat in environments that might include a chow hall that doesn't feel safe because it's overcrowded. You've got armed guards pointing guns at you while you're eating, or alone in their cells next to the odors of the toilet. And these stressful eating environments have actually been shown to have impact on things like metabolic health, which can lead to weight gain and cascading health issues just based on the environment alone. So in terms of some of the impacts of the food itself, you can see here it's fairly self-explanatory, some of the impacts that have been reported to us from people who've spent time incarcerated. And these are things that they directly attribute to the food that they ate while incarcerated. And there's also a growing body of research that delves into the connections between food and trauma. So when people are experiencing trauma and toxic stress, whether or not that's directly related to food, this has physiological effects on the body. And trauma and incarceration in and of itself is inherently traumatic. So the typical carceral diet of ultra-processed food is actually more likely to perpetuate a cycle of poor coping skills, like reaching for substances and other health issues, not to mention continuing to replicate that trauma on the inside. So why is this happening? What are the root causes? Many people that we talk to, especially correction staff and policymakers, immediately point to budget constraints and say there simply isn't enough money to provide better food. And that's actually more of a problem of prioritization of resources. The food budget is generally a Department of Corrections, about 4% of a Department of Corrections annual budget, compared to something like healthcare, which is about 25% of the annual budget, and security costs, which are often about 35 to 40%. And where does that prioritization come from? That is rooted in attitudes about the worth of individuals who are incarcerated and questions about whether, having caused harm, they are worthy of care. So we have to remember that folks on the inside are people's parents, their children, their siblings and partners and friends, and that they're human beings with a capacity for growth and change, as well as the fact that over 95% of the people who are locked up in the US will eventually be released back into the community. So we have to think about the implications for public safety when it comes to something like serving this kind of food to people who are incarcerated. And these attitudes also point to a lack of understanding about the profound impacts of food, especially when we're talking about ultra-processed food. And for better or for worse, how the impacts of good food or bad food on our bodies and our minds can ripple out not just impacting the incarcerated individuals who are eating it, but also have those ripple impacts onto families, onto communities, our society as a whole, and even the natural environment. So in terms of solutions, I want to share a couple of the projects that we're working on at the Food and Prison Project at Impact Justice. We work a lot in partnership with people who are currently and formerly incarcerated, as well as with community organizations. So one project that we have currently going on is our Farm to Corrections California initiative. This is a partnership with the University of California's Nutrition Policy Institute. They're working with the California Department of Corrections and Rehabilitation on a Harvest of the Month program. So we're bringing in every month local fresh produce from farms that are in the area of the prisons. And we highlight those things. We help support the local farmers through purchasing through local food hubs, bring those fresh items into the prisons, have those on the trays, and share a lot of materials with folks as well about what are the health benefits of these. We also teach a lot of the food service managers and food service staff how to serve these things and prepare these items, partly because a lot of them are not necessarily familiar with these products or the health benefits either. So you can see on here our Harvest of the Month poster from February. Our item was Murcott mandarins, also known as honey tangerines. They were very popular for folks on the inside who really lack access to a lot of quality fresh produce. Something else we're doing in California right now, we've created a trauma-informed nutrition education curriculum that we've been conducting in partnership with reentry organizations. And this year we'll actually be doing a Train the Trainer workshop where we'll be training folks from those reentry organizations to be able to facilitate those trainings to larger audiences from people who are continuing to return to the community after incarceration. And that really focuses on helping people heal their bodies after they've been impacted by the food on the inside. One other project on the other side of the country is our Chefs in Prisons initiative. We're working with Brigade, which is a company that puts professional chefs into schools. There we have a professional chef from Brigade in the Maine Department of Corrections who's really leading changes in food service operations, large-scale, high-quality culinary training for the folks who are incarcerated working in the kitchens. And this is a replicable model that we have poised to scale, so we're getting ready to expand that this year. Thank you very much.